Hi, I'm Tim Jones. I'm a consultant cardiac surgeon at Birmingham Children's Hospital. So what does that mean? Well, I'm part of a team who help look after children who are born with congenital heart problems. Warfarin stops the normal mechanisms that are in the body of clotting the blood. So usually within the body, blood goes around our circulation, which is all part of us, and the blood doesn't recognise it as not being part of us. When you've undergone surgery for single ventricle surgery or half a heart type surgery, part of that surgery involves placing a plastic tube. It's not any old plastic, it's a special medical grade plastic tube inside the circulation. Now the blood, when it meets that plastic tube, recognises it as not being part of the person and will try and clot on that plastic tube. Like when you cut yourself and blood falls on the floor, it clots. Well, the same will happen inside the circulation. So patients take a medicine called warfarin, which interrupts the clotting system to stop the blood clotting in the tube. Now that's a good thing if you've got a plastic tube in place. Where it becomes a problem is if you cut yourself, because the normal system that heals up that cut and stops the bleeding has been disrupted by the warfarin. And so a child who takes warfarin, or any person who takes warfarin and cuts themselves, will bleed longer. But that's not a major problem. That can be managed simply just with pressure on the wound, pressure on the cut, for a longer period of time. Normally if you're not on warfarin, it may take up to 5 minutes to stop bleeding, but if you're on warfarin, it may take 10, 15, 20 minutes pressure. The other situation, of course, if someone's to fall over and bruise themselves, because we all bruise when we fall over, but someone who takes warfarin will bruise more because they can get some more bleeding inside the tissues. That's all a bruise is. But of course the same thing applies if someone falls over, pressure on the area that they might have injured, and obviously just to keep a careful eye on them to make sure that there isn't any progression with bleeding, but that can normally then be controlled. Obviously what we want to do is to get the heart to work as strongly and beat as well as it can. Now everyone's hearts, whether you've had surgery or not, work to different amounts. They all beat to different strengths. And if we know that someone's heartbeat isn't as stronger, or the heart isn't squeezing as strong as we want it to, then we can use a medicine, as I said, called captopril as an example. It's also a medicine that's used to help bring the blood pressure down. Now on the whole, taking a medicine like captopril usually doesn't have a day-to-day problem, and we make sure that the medicine's set very carefully in the hospital. So for the day-to-day school problems, I don't see that should be a major thing, other than with all these medicines, it's obviously important that the person takes their medicine, takes them regularly, and I also think takes them in an environment where they're encouraged. There's not a big thing about taking medicines, because lots of people take medicines for lots of different things. And one of my concerns in talking to families is that obviously it becomes quite a thing for a young adult to be taking medicines, and the school obviously have got to work with that and make sure that medicines are available, that the teachers fully understand that someone needs to take medicines, and the right opportunities are given at the right times of days for someone to have that medicine. The third medication is what I said is a diuretic. Now this is the one that makes you pee, okay? Now we're using it because we don't want too much fluid collecting in the body. And the medicine works very well, so if you've got fluid collecting in the body, as it always does, because we drink and do everything during the daytime, and I'm not saying we should stop drinking, it's important to carry on drinking fluid in the daytime. But because the heart, if it gets too much fluid to pump around, may find that difficult, what we want to do is to make sure the fluid keeps on moving through the body. And taking a diuretic will make someone want to go to the toilet. And it's obviously recognising that certainly in the first hour or two after taking the diuretic, someone may then suddenly get quite a large urge to go to the toilet. So not only be able to get to the toilet, but also go when they need to go, and not a question of waiting, because their body will still be making more and more and more, regardless whether they go or not, and so they need to be able to get them. Why does low energy affect performance in exams? Well, we all know exams are very stressful times, and stress has a physical demand on the body. Even though you're not actually moving anywhere, you're sitting in a chair doing the exam. we know that actually getting to the exam, often getting to the exam rooms, again, up and down flights of stairs, maybe across courtyards, puts a physical demand on the person. We also know that just sitting and writing the exam and all the preparation that's gone into the exam will have been a stressful time and put demands on the person. The exams may last for 3 or 4 hours, and obviously if we're on the diuretic medicine that makes you pass a lot of urine, someone's going to have to go to the toilet during the exam, and that may well be up and down a couple of flights of staircases or a block away, but then come back to the exam, which is again a physical demand. So someone during an exam may well find that they don't perform as well. The other thing is that the medicines for the heart usually don't affect how well someone concentrates, but what we do find is that some of the other medicines that a child may be on for conditions not related to the heart sometimes can affect concentration. So if you've got half a heart or you've had heart surgery, should you not be able to achieve your full potential at school? Absolutely not. Everyone's different. Everyone comes to the classroom with lots of different things, tall and short people, right and left-handed people. Everyone should be able and encouraged to meet their full potential. And someone with half a heart should absolutely be able to meet their full potential. What they need is the right environment and an understanding by the people in the classroom and the school so they can be supported to reach that potential.